Hello, everyone. It's another Wednesday with your fertility specialist. I'm your host for today's session, Ruth Ogogo. I'm excited to be with you guys today. On behalf of Alps Hospitals, we love to say thank you to our dear viewers. Thank you for liking our post. Thank you for sharing. Thank you for always staying glued to your screen. As we get started, please feel free to drop your thoughts, your comments, your questions in the comment section. I will definitely attend to them appropriately. Today, we're talking about PCOS to PMOS. Well, to talk about that, we have Dr. Jane with us. Dr. Jane, it's good to have you with us.
Thank you for having me.
So we have Dr. Jane Ojani. For someone watching for the first time, a bit about Dr. Jane, she's a consultant gynecologist. She's a minimal access surgeon and also a fertility specialist. It's good to have you once again, Dr. Jane.
Thank you.
So, viewers, call up someone, share it with as many people as you can. A lot is about to be said. New inventions, yeah, we're here to talk about it. I'm sure some of us have seen this trend. No longer PCOS, but PMOS. So, we want to talk about it. So, please call as many people as you can so they can all understand what's going on right now globally and now everybody's able to follow the trend. So, Dr. Jane, PCOS to PMOS. Well, I'm sure you will let us know what they all are. But first of all, because I'm sure they are wondering what am I referring to as PCOS and PMOS. So what did you prefer to as PCOS before you revolved to PMOS now recently? And what drive you put into that?
Okay, well, PCOS as is a shortened form of polycystic ovary syndrome, while PMOS is the new name from a global consensus for the PCOS, as we used to know before, and it stands for polyendocrine, metabolic, and ovarian syndrome.
Okay.
Of course, this captures the true experience
Oh.
of patients with PCOS. Just we had only polycystic ovary syndrome. We limited the condition to what looks
Oh.
like misunderstood, like someone that has abnormal cysts. But
Yeah.
this new name encompasses the true experiences, and it will help with better understanding of the condition.
Okay, so in a way, so will it be right to say that since PCOS doesn't seem to explain everything, will it be right to say now that PCO is a bit of what people experience when they have PMOS? Should we say it as that?
Well, no, you see, when you have PMOS,
Yes.
now you can say PCO is a
Yes.
component of
Yeah.
PMOS.
Oh yes. Maybe I didn't
So
better put. Maybe I didn't
yes,
ask it
so
well. Yeah.
someone that has polyendocrine metabolic ovarian
Yeah.
syndrome,
Yeah.
yes, one of the components for diagnosis, you could also have polycystic ovaries.
Ovaries.
Now
Oh.
that is
Oh.
where the misnomer comes from,
Oh.
the confusion
Comes
that's
in.
always been there, because when
Hmm.
people hear polycystic ovaries, they've always assumed you have cysts. But what we now know is that you don't have abnormal cysts. What is seen on the ovaries are just follicles, what we call small fluid filled sacs,
Hmm.
that like immature follicles, or some of them arrested in the course of development with the high male hormones that most of these clients have. So you don't necessarily have to have cysts to have
Hmm.
PCOS, while you can have someone with cysts might not have the condition, what we call PMOS now.
Okay, so maybe we should talk more now about what this PMOS is all about. Like what possible things, symptoms that people would see that make them know that they're actually dealing with this metabolic condition. Yeah, what are possible things that they would like to see?
Well, so as the name implies, polyendocrine metabolic ovarian syndrome. So
Yeah,
yes, so I will take them in bits, because from the global consensus, and patients that lived this condition were also
yeah.
part of this renaming, and the things that
Mm.
kept featuring in their suggestions were polyendocrine, ovarian syndromes,
Yeah.
metabolic, and all of that. So everything came together. Now, when you talk about polyendocrine, you're talking about multiple or a lot of hormonal imbalances that you commonly
Oh.
see in generally patients who we classified as people that had
Hmm. You
PCOS
hear them saying
formerly.
they say
Yes,
I have
hormonal
hormonal
imbalance.
imbalance.
Yes,
That's true.
so this is so it affects a wide spread of hormones,
Mm.
and then you now have the metabolic component, yes,
Yeah.
so which is also a very important factor, even in the pathophysiology or the development, the condition itself, understand the
Yes.
condition.
Yes.
And most importantly in that is what we call insulin resistance.
Oh.
It features in this condition, very important.
Oh.
So,
Okay.
and these metabolic conditions also, you can also have things that affect the heart, weight
Hmm.
fluctuations, and
Wow.
all
Wow.
of this,
Hmm.
even some liver conditions. So you see that is a lot, not just
Yes.
then we have the ovarian component still. So that's why we still have ovarian syndrome
Syndrome.
is
Oh.
still there. So unlike what we formerly narrowed to just a reproductive condition, now you
Yes.
see that a multi-systemic condition, and this renaming has helped would also offer the patient holistic care compared to what they used to have, fragmented care. You
Hmm.
know, a lot of times the clinicians, once they do a scan diagnosis, they say you don't have PCOS. But now we
Oh.
understand that you can
Yeah.
have PMOS without
Yes,
cyst.
cyst on the ovaries. Wow, so that means people that have this PMOS, they are likely to also come down with things like diabetes is something that they might also be
Very
dealing with.
important, very important. It's
Hmm.
part of the metabolic conditions they can have. So from the
Wow.
insulin resistance,
Yeah.
they you know what it does is that the body doesn't respond to insulin.
Hmm.
So the pancreas where insulin is produced
Produce
senses it as you don't have enough insulin,
insulin.
and it
Wow.
keeps producing a
Producing.
lot more. Along the line you can develop diabetes, which
Wow.
is one of the
Comes
complications or
from it.
conditions that the
Wow.
patients with, well, formerly PCOS, now PMOS,
Yes.
can have.
So let's narrow it down to fertility. What are possible people now that have these conditions? What are possible things that they would likely see that are like, should I say, pointers that okay, maybe you need to go and be evaluated and check. Maybe you might just be having this and all.
Well, so common features that you'll see, you have menstrual irregularities. It
Oh,
can be to increase menstrual cycle length. So women will
yeah.
have infrequent periods. People that have less than 8 periods in a year,
Hmm.
so you know that you're not having regular periods, or
Periods.
people that
Wow.
have very long menstrual cycle, anything more than 35 days,
Days. Hmm.
because of course once it goes beyond 35 days automatically means you're not seeing it in the month, so
Yes,
that
that's true.
shortens the number.
Hmm.
Yes, then sometimes they can bleed, their menstrual the bleeding from the periods too can be
Yes.
unpredictably very heavy
Hmm.
and
Wow.
sometimes scanty.
Hmm.
Yes, those are features for menstrual irregularities. Then you can have some features from the, we talked about androgen excess. Androgen is a
Yes.
male hormone, is male hormones, and that is characteristically seen in high value levels
Hmm.
in women with PMOS.
Wow.
So,
Wow.
and it presents as excessive body hair, facial
Hmm.
hair on the
Yeah.
chin, on the chest. Yes. So women can also have male pattern balding,
Hmm.
and of course some form of acne on the chest, on the back, that sometimes are difficult to manage. Those are
Wow.
some of the things you can see that would suggest. And of course fertility challenge.
Hmm.
Some
Hmm.
women, in fact, a good number of women, and that is where the confusion has always been,
Being.
because
Yeah.
most times once a woman has it just she's moved to the gynecologist for fertility evaluation, but now
Yes.
understand that other clinicians have roles to play even when
Yes.
fertility is not in view. But of course one of the things you see for some women that keep trying to conceive and they're having delays, you
Yes.
need to come and be evaluated, because with PMOS you don't ovulate frequently, and when
Hmm.
you don't ovulate, the chances of spontaneous pregnancy
Pregnancy.
is almost not present. or for them they have irregular periods, so you cannot monitor your fertile window. So fertility too is that. Then when you have other features of insulin resistance, like you have some dark lines, tags, because it can affect even the skin. You
Hmm.
see people with a lot of tags on skin tags.
Yeah.
Yes, it's a feature of insulin resistance. Some of those things, because cosmetically or aesthetically, they don't look appealing to some. So
Oh,
you can present for
with
management.
that.
So
Hmm.
this is a symptom spectrum. So you can see that I've cut across a lot of organs, hormones, and
Yes.
all. And that is the essence for the new nomenclature.
Wow, a lot with PMOS, a lot, a lot. So now, does it mean that? Well, I'm just thinking. This is me thinking. Are there women that actually could have this PMOS and they seem to have everything figured out? Like when I mean everything figured out, everything seems to be going smoothly. They are not showing any symptom at all. Pregnancy is not an issue. They are not having miscarriage. They are not even showing any symptom. Those people, how would they even know to begin with if they are not even showing any symptom? Are there people that are really like that with this condition?
Yes, you can have PMOS
Okay.
and not necessarily have classic symptoms.
Oh,
As I
okay.
stated in our last
Yeah, yeah.
introduction, that
Mm-hmm.
fertility challenge is one of the reasons a lot of women present for
Yes,
evaluation, and
that's
some of
true.
these
Yes.
imbalances in hormones and all of that are
Mm-hmm.
picked.
Yeah.
But again, they have erratic ovulation. So a woman
Yes.
can get pregnant at different times.
Mm-hmm.
And you see, that would not qualify for, but you would still see, sometimes you will see this menstrual cycle challenge and all.
Irregularity.
It's not almost entirely, but you see, some of them will ovulate at some point and they can still get
Yes.
pregnant spontaneously without any aid from anywhere. So they can still live their life, not have very the challenges, because what depresses, by the time you're trying for a child, you now
Yeah.
begin to have tags, having bad acne, your
Mm-hmm.
mental health is affected,
Yeah,
your
yeah.
social appeal is affected. So all of those
Mm.
things have a role playing in your mindset. So it gives you keeps you in a place where a lot of women will not want to be. But when you don't have to look for some of this, you are not faced with some of these challenges,
Challenges,
you
that's
tend to be living a
true.
normal life. But and also those risks, for some women, yes, you don't have regular periods. If you see your period from time to time, you shed your lining, your risk for the complications, long-term complications too, are
Is in
significantly
essence.
reduced.
Well, so this is me thinking, sometimes you have some women that maybe just maybe they had their first child maybe at 25, and maybe they now got into a relationship or they are now married, and then pregnancy seems to be a challenge now. And then you now wonder, maybe it just makes me wonder, are there some lifestyles that actually predispose these people or that favors this condition, or does age have an impact too on this condition? Because when you hear a woman say, okay, I gave birth this, or when I didn't need pregnancy, I had some terminations, and then maybe now she's coming in, maybe she's been trying and everything seems to be pointing at her, and they're telling her maybe you have this condition, and she's like, but I had pregnancies and all that, I terminated and all of that. So you just wonder, there's some lifestyles that maybe earlier on in life it didn't show, then later on is now beginning to become expressive and all that. Well,
Yes,
yeah.
yes, very correct. Some this condition, um, it worsens over time.
Oh,
So
oh,
worsening doesn't have to be physical.
oh, I
Yes,
see.
sometimes the way it affects your ovaries,
Mm-hmm.
the amount of male hormones now in the system, the distortion in the balance, and again, of
Mm,
course, lifestyle. As we age, a lot of people
yeah.
now can afford some of those things, and they live some form of affluence. So they are now gaining weight uncontrollably, and all of
Mm,
these have impacts
oh,
in your. So when you were 25 or 22,
mm,
you were more active, exercising, doing a lot of dance. All of these help to improve this condition. Then you
yeah,
are
I
now at
see.
30, you're
Mm,
inactive, you are bigger, and the
don't
hormones
blow.
imbalances are worsening and progressing. So yes, you can have that picture in
Mm,
a few women. Yes.
maybe at 30 now, she don't make am for life. Like they'll say, maybe she's like you said, affluence. Maybe she see more money and then she's affording
Yeah.
a lot of things that makes
Yeah.
makes luxury very easy, and then
Diets,
and life very sedentary.
inactivity. Yeah.
Okay, so hope we're noting that that's okay. Yes, as much as this is a condition, she has let us know some of the lifestyle that could actually encourage it, like okay, making the make the condition look worse. And there are some lifestyle that might just be in favor, like okay, lessen the symptoms that you see. So it's for you to embrace a good and healthy lifestyle, even though you have some people that will say, well, I've been a good girl, I don't know why this is happening. But sometimes they say life is not fair, or sometimes they say good things still, bad things still happen to good
Good
people.
people.
Yeah. So, yeah. Well, so now are there points that are there extreme cases of this PMOS now that you now have to recommend maybe higher level of fertility management for people? Because you mentioned that yes, it's possible for them to conceive spontaneously. So is it possible that there's an extreme condition that they can get to where you now say, okay, this one now has gone past the level of you trying, maybe we should try some other things to better improve this condition, and as well as improve your fertility chances of conception as well.
Yeah, definitely. So, for fertility to for a woman to get pregnant, every of the factor responsible from the brain down to the uterus and the outlets, they are
Yeah.
supposed to be functioning at the way they are supposed to be.
Yeah.
So the fact that a woman has PMOS doesn't mean she cannot have other conditions like blocked tubes. She
Mm.
cannot have growth in her uterus like fibroids and
And
all of
oh.
that.
Mm.
Then the fact that she has PMOS doesn't mean she cannot have a partner with poor semen
Mm.
quality. So you see that sometimes yes you would have PMOS and yes ovulation is a challenge, but
Yeah.
some other factors are there, and not just by giving you drugs to induce ovulation. So you might need other higher level for
Oh.
women with blocked tubes and all of that. Even for those that have unexplained, yes, you have PMOS, we have given you drugs for you to ovulate and nothing
Yes.
is happening.
Happening.
You have tried the other forms of fertility treatment like intrauterine inseminations. If
Mm.
everything, all the conditions are
In
met,
place.
yes.
Yes.
So if nothing is happening and every other thing has been, yes, why not go for a fertility treatment? It doesn't have an endpoint. You
Yeah.
keep going until you
Mm-hmm.
achieve success. So
Yes, that's
yeah, so
right.
women with PMOS can also have fertility treatment like IVF,
Done.
intrauterine insemination, and all of that.
Okay.
Any of the options that fits them,
Could
it's good to
actually be
go.
preferred.
Yes. Yeah.
Okay, so well, yes, it's good to know that you could also actually assess some of this care. It's not a write-off case that you have PMOS doesn't mean that's the end of the world, and doesn't mean that you can still not achieve conception. So it's just for you to trust your fertility specialist. That's if you have dealing with fertility issues, trust them for the best of counsels, and never compare yourself. We say that a lot. Never compare yourself with another person. Everybody's treatment and peculiarity is different. Even when in the family, it runs in the family, the degree might be different for everybody.
Sure.
The way your sister's own might be, yours might be severe or less severe. And that's why you don't just assume, hey, let me see that medication that they prescribe for you, and then you just want to start taking it and say maybe it's work for you. It just might be peculiar to you alone. And that's why you have to trust your fertility specialist to give you the best of counsel. So I'm also going to ask Dr. Jane, how do people manage this? Because I know that people will tell us that there's no cure for PCOS. So now we know that it's a lot more beyond PCOS now. It's more like a whole systemic thing now, not just one part of the body. Are there ways to manage this condition? Is there a cure? Is there something that can just be done to improve outcome of life generally for these people?
Well, yes. So, general, just like the symptoms I mentioned, we can manage them, but most
Okay.
importantly, conservatively, when we
Hmm.
start with lifestyle,
Hmm.
weight loss, dieting,
Yeah. Yeah.
exercising, good sleep,
Mhm.
and all of that. Yeah, because those would significantly improve your hormones, the balance. Now, for the general conditions you have with this condition, like insulin resistance. So now, when we say polyendocrine, we say it's a multi-systemic. It means that you can
Yes.
have multi-specialty management. So
Oh,
you
I
don't
see.
limit it to the gynecologist like it
Mm.
were like before it was just a
Yes.
gynecological condition.
Condition.
Now, so for those with cardiovascular condition, the cardiologist can manage, and whatever the problem is can be sorted out. Endocrine diabetes, the endocrinologist can manage. And of course, those with fertility challenges, we keep going. Yes, with
Yes.
weight loss, ovulation induction, um, you manage every other condition around it, help them
Yes.
get pregnant through every means of treatment, intrauterine insemination, IVF, you go all the way for them. So for all the conditions that I mentioned, so there's a specialist for them, and that is the idea. Even for those with skin tags, acne,
Yeah.
that's where the dermatologist comes
Comes
in. So
in.
you see that multi-speciality management helps also reduce the fragmented care these women used to have in the past. Now we are looking at holistic care
Care.
for them.
Wow, that's a very, very good invention. We're happy with the revolution of PCOS to PMOS, and we hope that somehow it gives better management since it's going to be multidisciplinary now, like a lot of departments managing it. Yeah. So, as we wrap up on this, what's your counsel to people generally on yes dealing with this? Because I know that it's a lot for them. Yes, in the past I know we've attributed it a lot to the ovaries and all of that, but now that we know that it's widespread, it's not just on the ovary. What's your counsel to them? Generally speaking, about everything, how to just cope with life, because sometimes they just feel like this is a death sentence. So really, I'm going to deal with this for life and all. And looking at the things that they are at risk of, conditions that they are at risk of, what's your counsel to them in general?
Yes, so my counsel to those with PMOS, even though we say it's a long-term metabolic and
Yeah.
endocrine disorder, um, it can be managed
Mm-hmm.
at every stage for
Yeah.
every condition. You
Yeah.
can be managed, well followed up, and commonly, as we always say, those fertility concerns are is the biggest indication or reason we see a lot of these women.
Mm.
And for women with PMOS, it's something that can be dealt with and managed successfully with live births and
No.
babies in the hand. So
Mm-hmm.
you can be managed for whatever condition you
Need to
have.
deal
It
with.
depends at the stage you are met, and you also followed up for the complications that are associated with this condition.
Yeah.
Even in pregnancy, there are risks for medical conditions like
Mm-hmm.
gestational diabetes, hypertension, they
Yeah.
are there. But when you are well followed up and all of that, you are better off. Outcomes are
Yes.
better, and
It's
of
true.
course, the life um
Expectancy.
your life expectancy is a lot better.
Better. Thank you so much, Dr. Jane. So, viewers, I would say that knowing that this condition is not just specifically on the ovaries, I think that early detection would be very, very important. And that's why Dr. Jane has enlightened us on the symptoms, things that you look out for, that are pointers that you need to check yourself. Do not just assume. Sometimes some ladies don't see period and be like, I think it's stress. Maybe because I've been stressed, I'm not sleeping well. On the contrary, some people even see their period earlier than they're supposed to when when they are stressed. So that's why you don't just assume and then just stay like that. Or some of them will say, one time I had infection. So and I had to by the time I drank something, the period now came, and then you just assume that's it. You should check yourself properly, identify whatever the issues are on time so you are able to get attention on time and better salvage the situation or better manage it to a very large extent that you are able to have high expectancy from life and from fertility and whatever it is that needs to be salvaged. Dr. Jane, thank you so much for such an insightful session. And viewers, thank you so much
You're welcome.
for having us on this session today. It was good to have you all attend to us on this. I can see comments from patients. Haruna saying, "Well done, Dr. Jane." I also have comments from Sintiki saying, "God bless you all for what you do." I mean, that's so you all at Alps Hospitals. Thank you so much for the comments. Facebook, thank you so much. So, our viewers, please keep staying tuned to all our handles. Check out for every notifications that come your way on our posts, various posts, videos, messages, in whichever form they come. This is also enlighten you. This is also let you know more of what we do. We look forward to seeing more of you in our next session. But for now, we hope that you have a lovely evening. Bye.